Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Joining me today is Dr. Katie Clark, who has been a data scientist at Chestnut Health Systems since 2023. She began her career providing social services and counseling to individuals experiencing substance use, mental health, homelessness, trauma, and medical conditions, including HIV and HCV. This clinical background laid the foundation for her transition into research. Katie, hey, welcome.
Oh, hello. Glad to be here. Thanks for having me.
Oh, thanks so much for taking the time. I know you, as is the case with all of your colleagues. You're very, very busy, so I really do appreciate you squeezing this in. First, question I ask everyone right from the jump, what drew you to become a data scientist, and more particularly, what drew you to the kind of research that you do?
Yeah, that's a great question to kick us off. And I was not drawn to the field of data science. I stumbled into it. And what I mean by that is I've had kind of three large pivots in my career that, like my bio says, really set me up for success in this space. So my first career as a young adult was I was a peer outreach worker. And the first 10 years of my career was social service based. So I worked in group homes, I did street outreach, I worked at clinics that provided people with equipment for safer injection use and safer sex options. And I worked in methadone treatment, and was a clinician, and also worked in management and was a certified clinical supervisor. And all of that experience with people really grounded me in my clinical skills. So when I did my first pivot from clinical work, I was like, oh, I'm always implementing best practices, but how do best practices get created? And best practices come out of research. So my next pivot was from the clinical world into the world of health services research, specifically in a research program that was exploring the connections of HIV and incarceration on the health of both the incarcerated person and the health of their sex partners. And in that work, I not only administered surveys and understood survey data, I started to work on building systems to help data collection. And so that was the next 10 years of my career, was really understanding health research, math and statistics. And I did that both in formal education and then also through a lot of on-the-job learning.
Is that a typical progression? It strikes me that it may not be. So, for instance, I know in medical school, you do a couple of years of study and classroom work, lecture hall work, etc., and then you do your clinical rotations. You seem to sort of flip that script. Again, is that progression atypical?
From my experience, it is people who are drawn to clinical work are generally not the most interested in data and statistics. They need data and statistics to do their work, but ultimately they want to work with people and talk with people and help people solve their problems and build life skills. Those people generally like that work. And at the same time, the people who are drawn towards, data collection and software development enjoy learning the languages to talk to computers, not improving their language skills to talk to other humans. And this is there's different flavors of data science. And so, but like where mine really comes in is that the domain knowledge around substance use, mental health, service providers, understanding health research, understanding math and statistics. And then my last pivot was I went from sort of just passively using data collection systems to actively building my own and using custom
Mm.
code and custom software to build systems that not only collected data, but helped manage the data workflow in a research setting. So it's sort of that Venn diagram of domain knowledge and math and statistics and health science understanding, software development, understanding technology, and computer science that sort of led me to the world of data science, which is not a typical trajectory. And that's what sort of makes data science a unique discipline, is that it often blends all of these skills. People who are in data science often are the great translators between disciplines. We really have to be good at
Sure.
disciplinary work because we're helping people understand their data, extract knowledge from their data, and in my case, helping people to build systems that leverage data collection as well.
Do you miss the clinical work?
No, because I use that skill set every day.
Ah, okay,
When I
but the actual day-to-day interactions you don't do. I mean, is that a
no,
component?
I don't, I'm not actively, I still have my clinical license, but I am not providing clinical care at this point. Um, I don't, I don't necessarily miss it because again, I feel very connected to still doing that work in a way because I'm not sitting in an office or out, you know, in the community providing services, but I get to support people who do that. So I still feel very connected to that work in just a different role.
Tell us about your work with CRICIT, which stands for Clinical Research Information Core for Integrity and Tracking Systems.
Yeah.
That's quite a mouthful. Beginning with what it is and how it helps researchers maintain fidelity to study protocols.
Yeah. So one of my previous positions was I was a project manager for a large clinical trial. And we had data collection tools for like the survey instruments. And oftentimes that's where people focus their attention on how you manage the data collection. But there is all sorts of other data collection relevant workflows that are not managed the most efficiently. I was observing people using multiple spreadsheets and lots of color coding, and there was lots of opportunities for error. And then when you started to think about managing the system across multiple locations, it just became very challenging very quickly. And I realized that in order to efficiently manage this project, we needed something more rigorous than spreadsheets. As I investigated different software options, I had previously done some of my work in data collection. I'm going to pivot for a second. Some of my work in data collection really helps people assess what data they need to collect, what methods they should use to collect that data, and how that data should be stored and documented. Sometimes a paper survey is exactly what you need. One of my projects, we worked with law enforcement officers and they were used to filling out paper forms, and that was going to be their preferred data collection. So we went with paper forms. There are other times when there are a variety of online survey tools that you can use that are very simple to very rigorous. As your protocol becomes more complex, the more aspects you have of it, the more people that are in the system, the more that you need a software that's truly supporting your work to reduce staff burden and burnout and improve high quality data collection. And so I looked at various different software to do that. And I had done relational data building in Access on the from Microsoft, and had built some great systems in the past. And I found out about FileMaker, which is a more updated current version of a custom software that you can use to build and support workflows that both have a solid relational database tables on the back end, but a really user-friendly front end that allows people to navigate the system in ways that support their workflow and doesn't feel like adding a burden to their work, but instead makes their work easier.
So you use that software to customize the Cricut system, and so it's based on what is it, FileMaker, did you say?
Yeah, so FileMaker Pro is the platform, and then building it out is where the customization comes in. So what data is collected and what the interface looks like, the different workflows that are supported. Some people need to have a sophisticated randomization protocol. Some people have to have a screening tool and they have to meet screening criteria in order to be enrolled. Every research project is unique. And because it's unique and there's different workflows that need to be supported, that's where CRICIT shines, is that we can truly, if you can explain what needs to be done, we can program a workflow that's going to support your work and where the integrity comes in is that we have lots of checks and we have lots of ability to throw error messages to people to say like, hey, you said you put in 45 and how many days did this person, use a substance in the past 30 days and you put in 45, we're going to say, sorry, you can't continue until you put in a valid digit. That's a pretty simple explanation, but we do a lot of protocols around people who are incarcerated and incarceration checks, and those sorts of customizations are really unique because to meet the needs of the research protocol.
Now, is this used specifically by and exclusively by Chestnut Lighthouse people, or is it also made available outside of Chestnut and Lighthouse?
So, I mean, in general, FileMaker is really used more in the business world. I think it's underutilized in the research world. And I think there's a lot of opportunity to build partnerships so that more people can have access to a CRICIT system and have it be customized for their specific research protocol. I have, in my previous work, I've built CRICIT systems for other people. Right now at Chestnut, I'm only building systems for current Chestnut projects. But we've had conversations with people who may want to use the platform for some of the work that they're doing. So those conversations are, in theory, people can have access to a CRICIT system.
What is roughly the range of time required to customize CRICIT per research project?
That is a really great question. There isn't truly an easy answer for that because it's so different. And the reason that it's so different is because some protocols are more straightforward than others, but it really just depends on what people's needs are and what their timeline is. So I'm often working on multiple systems at a time. So if you're planning to start your project in March and we're in September now, we'll kind of put a timeline together that gets you on track for March. But the timeline for building a CRICIT system really just depends on the project. So it depends on the team's timeline, their availability, how much guidance they can provide, the experience of the developer, what features are needed. There are new features,
Sure.
things that we've previously done. So in some cases, they can be ready in a week, and sometimes it needs a longer time because there's more coordination and customization. And what also happens is that people are not used to being able to customize at this level. And once they find out what the software can actually do, they then want more.
Sure. Sure. You mentioned project involving law enforcement where paper-based forms or whatever the project entailed was perfectly adequate, and that's what they were accustomed to using. If it ain't broke, don't fix it.
Mhm.
Do you find yourself pushing, for instance, Lighthouse researchers to use CRICIT, even if in fact they're more accustomed to whatever they're accustomed to? Is kind of makes sense from my objective perspective to standardize on CRICIT to make sure that everybody is using the best and perhaps a more centrally managed process.
So this is a great example of where my clinical work comes in.
Okay,
Because when you're working with a client, you want to meet the client where they're at. And when you are talking about stages of change, you want to identify what stage of change your client is in and meet them with an intervention that's an appropriate level of stage of change to help them move towards their goals. And I do the same in data management. If there is a short survey that someone wants to program and it's going to be used once, you don't need a CRICIT system for that.
Mhm.
Want to make sure that because it can be labor intensive to build the systems and have it work right. And sometimes if things are truly simple, then it's not what you need. Could we do it? Absolutely. But there are other products that might be able to do it just as good. Where CRICIT really shines is when you have a protocol for a longitudinal study. where you have staff that are tracking participants over a period of time, and you're collecting locator data, and you're collecting metrics on surveys, and you're sending them thank you cards. That's where CRICIT really shines. And so if you wanted a CRICIT system, you could certainly have it, and there is benefits for doing that. What we don't want to do, though, is have piecemeal a whole bunch of like if you're piecemealing a whole bunch of systems to manage your workflow, that's an indication that you may need a CRICIT system.
Yeah.
If you're doing a one and done survey on what staff want for lunch, you do not need CRICIT.
Right, 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 exactly. Beyond data collection, what key research processes are CRICIT systems designed to streamline?
There are some particular tasks that every research project that I've worked on has used. So there's usually some sort of referral and screening, randomization, collecting locator information, collecting one-time enrollment data, which might be on pregnancy status or other sort of like incarceration statuses, referral to treatment, and tracking all of your survey appointments. And then also your interaction with participants. So documenting when you've contacted them, when you've sent them a mailing, when you've emailed them or texted them, whatever it is. Those are some really standard things. Also, consenting people. All of those workflows, almost every research project that I've worked on has needed that to some extent. And that's the base. That's our foundation file that I've been working on. So those are the things that CRICIT really shines. And then all of the things that make your project unique, we can help manage that workflow as well. So anytime you're about to go make a spreadsheet to go track something or keep track of a to-do list, again, that's sort of like an indicator of something that CRICIT could help you do.
How much involvement does it require from your standpoint? You know, you've designed a CRICIT system. Is it pretty much okay? We designed it. I mean, do you find yourself providing a lot of oversight and support?
So the process usually is something like we have a meeting to talk about what your data collection needs are and what your project looks like. I will usually use grant applications or protocols that people have developed to help me understand kind of like the large workflows. Over time, I have built out these different aspects. So when we've figured out what's worked really well for people, but every time I make a system, find a new way to improve it. If it's a different icon or something else that it's also really fun because people will ask me like, and most recently, one of our projects, the project coordinator was like, "Oh, I'd really love to be able to track the outreach that I do to the community organizations to help with recruitment. Can I get an outreach tracker?" And I was like, "Oh, how have we not had that before? Of course you can have that." And so now that's kind of in my offering. I kind of present people with a menu, and then it's like going to a restaurant and you get what's on the menu, and then well, I want this, but I want extra maple syrup on the side. You know? And then I'm like,
Right.
oh, of course you do, because you want extra maple syrup, no problem. The question is, as far as like, how I'm very involved and I'm really active. So, and this again, this is the difference between my experience working with someone who is sort of a traditionally trained program, like, software engineer. Is they are told what to do and they do a great job executing that. But because I have a deep understanding of research, and people who are in the field and work with researchers will understand this, but you then anticipate what they need that they don't even know they need. I'm like, oh,
Right.
I know you've said that you want this and you need that. You also need these three other things. And they're like, oh, we hadn't thought about that. And that's also, again, kind of some of my clinical work is like anticipating the needs of others, and helping them figure out what will be helpful for their process. And people who don't have training in, statistics, or, research analysis
Hmm.
wouldn't know even things as far as like, I mean, how you name variables. you can really see when someone who has sort of more training and data analysis, how they name their software, how they name their variables versus someone who is again more trained in software and computer science. There's a real big difference there.
No, that is a really important point because I've done a lot of work on the software development side, working with developers or, providing biz dev consultation and guidance and so on and so forth. And what does tend to happen is that developers have their own idea what a piece of software needs to look like, and they kind of get a little bit far afield from what users need.
Yeah.
And what they may think is a cool feature is not something that's going to be a practical feature, or what they develop may be overkill, and you only need 10, 15% of it. So it really is important to have that domain expertise, as you mentioned, to design it. And
Yeah. That's also where the research education comes in, is because in other software, oftentimes one member of the team is getting a better experience than the other member of the team. So, for example, you may be using a particular piece of software to collect your data, and the data analysts are super excited because it spits out all the things that they need and it's super easy. But the people who are collecting the data are like so bummed out because like it's on a very nice interface, or it's really clunky, or you have to do a lot of clicking to get what you need. And what I try to do in Cricut systems is really make everybody happy. I try to think about, I want the system to be great for our frontline staff who can get really burned out because they're working day in and day out with our participants. And anytime you're interacting with people, I have, I mean, I don't talk about this in my professional bio, but I have done a lot of customer service, and that is a really hard job. And doing research and working with participants is a different type of customer service. So I want to make sure that our frontline staff really have a system that works well for them. Things are intuitive. It's aesthetically pleasing. And then I want to make sure that when our analysts get the data, that they have variable names, that they know what they're called. I've seen systems where people call things drug one, drug two, and drug three. That becomes really problematic when you go to do analysis. And then also I want PIs and our principal investigators and our research leads to be able to have metrics, to be able to track how their project is coming along and how our retention rates. So that's somewhere else that Cricut really shines, is that it's really the software that's built for the whole team and doesn't sort of play favorites of who gets the better
mm,
experience.
yeah, these days, anytime I have a conversation that's even remotely technical, I have to bring in the AI question. Are you incorporating any of that? Are you looking to incorporate any of that? Do you foresee how that could work?
Yeah, it's really it's they're they just released a new update to FileMaker, and in that is the ability to use natural language processing to ask questions of the software and have it spit you back an answer. So you could do things like, how many people are currently enrolled in the study? How many people have completed the study? And it will be able to give you back an answer. I have not done any programming in that yet, but I think that will be a really exciting opportunity because part of my part of the vision that I bring to this work is really data accessibility. I want people to have access to their data and reduce gatekeeping, which is somewhere else that Cricut shines. In other systems, sometimes you have to have the data taken down and someone do analysis in order for you to get some kind of basic information, where in Cricut systems, we have dashboards that allow people to update their data in real time to sort of see where their metrics are at. But that would also be an opportunity to incorporate that kind of data analysis on the fly. So if you're in a meeting, you need to know something that isn't on your dashboard, not on your Cricut dashboard, then you could potentially type in that question and get that answer. So that's an
Well,
exciting frontier.
yeah, for sure. Speaking of exciting frontiers, any projects you're currently working on you want to highlight? Now's your chance.
Yeah. Well, currently we are in the process of, I mentioned building a foundation file, and the foundation file has a lot of those elements that are really critical to most research workflows. So the referral and screening, enrolling, setting up the research schedule, a comprehensive locator form, sort of like tracking and contacts. And having that built out will allow us to really reduce the sort of the lead time on getting systems created for people. I'm also in the process of training multiple Chestnut staff on developing in FileMaker, which is really exciting to watch people learn the skill set. And I'm a very applied learner, so I can take all the classes I want, but unless I'm doing it for a purpose, I'm not
Right.
retaining much. So it's been really fun. I've had the opportunity to have, last year I had a CRICIT workshop and taught people some FileMaker basics, and a few people have continued their work with me to both understand the design aspect and then also the back end coding and database schema. So that's a pretty exciting project, and hoping to have more staff learning how to do this, because it's really empowering to build people what they need. It's just, and I also love saying yes. And that's the other thing I love about my CRICIT systems, is that I just get to say yes. People are like, can you do this? Can you do that? And
Right.
I'm always saying yes, which is great.
Katie, I really do appreciate your taking us behind the scenes,
Yeah.
giving us a sense of how Cricut has worked and some of the ways it will work in the future. And obviously, it's intrinsic to what you guys do. So I'm glad we had this conversation. Thanks so much.
Yeah. Thank you.
Today, I spoke with Dr. Katie Clark, who has been a data scientist at Chestnut Health Systems since 2023. She joined me today from her office in Bloomington, Illinois. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.